Good afternoon, everyone, and welcome to today's Corporate Insight webinar, Generative AI in Healthcare. I'm Crystal Oji, a senior researcher here at CI. I hope our insights can help you hone your digital strategy and approach AI innovation head-on as the digital health landscape continues to grow. Before we dive in, I want to pose you all a question. What do you envision healthcare will look like in the next 10 years? Do you see robot surgeons, or do you have a more conservative vision, where open enrollment is done with a few taps of a mobile app? Regardless, you know that AI will be integral to this future. Within just a few years, AI has permeated into our daily lives. Tools like ChatGPT and Google Gemini have raised consumer expectations as to what digital platforms should be capable of. Patient expectations are soaring. Now it's time for digital healthcare platforms to meet the challenge. Healthcare stakeholders like you must envision how you can leverage these tools to innovate. Failing to act may jeopardize future engagement. So today, I'll help you answer the pressing question on every healthcare strategist's mind. How can I implement AI to drive lasting user engagement? Here's our agenda for the duration of the webinar. We're going to start with a quick introduction to corporate insight and our unique methodology. Then we'll dig into the consumer data you came for. First, we'll examine the current usage and behaviors of healthcare consumers. Next, we'll move into patient demands and narrow focus to assess the most popular topics users are researching with AI. We'll also examine where individuals are seeking meaningful support from generative technology, and we'll help you brainstorm engaging implementation strategies. After that, we'll look at how you cultivate trust and engagement with the implementation of AI tools. By addressing critical gaps in transparency and education, you can instill your healthcare consumers with a greater sense of confidence in your digital platforms. Finally, we'll give you a sneak peek into how major healthcare players are implementing AI and what you can learn from your competitors. If you have any thoughts or find anything unclear, please submit your questions through the chat feature at any point during the presentation. I'll do my best to answer them during the question and answer segment at the end of the talk. First, let's talk a bit about corporate insight. For those of you who might be new to corporate insight, we've been connecting firsthand customer insights with industry expertise since 1992, researching digital experiences for as long as they've been available. Our clients are leading financial firms, insurance companies, and healthcare organizations. We provide them with a host of competitive intel and research services to empower them to build best-in-class digital experiences for their customers. Our services span 5 key areas. First, we have our Monitor research services, which includes the Health Plan Monitor. All Health Plan Monitor subscribers have access to the full Generative AI and Healthcare report and receive monthly updates on innovative digital tools that appear across health insurance websites. Second, we have our Experience Benchmarks. These are comprehensive annual studies with quantitative scorecards and strategic recommendations. They rank your digital platform relative to other industry players so you can identify where you're behind and get ahead. We also offer 3 customized services: custom research projects, UX research, and quantitative research, all designed to provide tailored, data-driven insights that drive your business's growth. Our Health Plan Monitor tracks over 25 health insurers, including industry leaders such as United Healthcare, Aetna, and Kaiser Permanente. We publish industry updates every month that review major digital changes, as well as quarterly Excel workbooks with a comprehensive catalog of their digital capabilities. Each month, we publish a deep dive report that hones in on an essential aspect of the digital insurer experience. Recent topics have included live chats, virtual assistants, claim functionality, and care team management. We also include data from proprietary surveys and user interviews to further supplement our analysis and provide you with genuine consumer sentiments. Now, I want to tell you more about how we crafted this report and the data that drove our insights. In this section, we're going to examine the survey foundation and our key findings. In January of 2025, Corporate Insight conducted a survey of 573 individuals. They were at least 18 years old, lived in the US, and had used generative AI in the last 6 months. We specifically targeted this group to assess a population that has a baseline understanding of generative technology, and thus will provide more informed insights into user behavior surrounding AI. Our analysis focused on revealing usage patterns through 3 strategic demographic lenses: AI usage in healthcare, AI literacy, and AI usage by age cohort. We categorized survey respondents into distinct breakout groups based on these areas to reveal meaningful insights. To understand the behaviors of individuals who use AI for healthcare, we segmented respondents into healthcare respondents, those who have used generative AI for health and medical information, and non-healthcare respondents, those who don't use AI for healthcare information, but use it for general purposes. Those purposes included things like financial services, education, and entertainment or art. The respondent group was split 50-50 between these two types of users. We also segmented our respondents based on self-reported AI literacy levels. Respondents were classified into three categories: high, those who indicated an extensive to strong understanding of AI; moderate, those who indicated a medium understanding; and low, those who indicated a limited to minimal understanding of AI. Thus, we have high, moderate, and low literacy levels throughout our survey analysis. Finally, we grouped respondents by their generational cohort. Respondents were grouped into one of three age categories: Millennials/Gen Z, Gen X, or Boomers Plus. Next, I want to share our key findings from the report. Firstly, generative AI has become an incredibly popular source of information. Gen AI has become more popular than health insurer and health system sites. That means targeted integration should be an utmost priority for digital health platforms seeking to maintain or increase engagement. Users have a clear preference for mobile-based AI systems. Individuals who had used AI on both their mobile and desktop devices indicated a preference for AI usage on mobile apps. Building AI tools into apps puts the possibility of increased usage right at patients' fingertips. Developing user-centric AI tools will draw on younger generations. Millennials and Gen Z demonstrate the highest AI usage and literacy levels. These digital natives are already using AI to navigate their healthcare journey, and health insurers that meet them where they are with intuitive, well-designed AI experiences can establish lasting relationships. Firms should focus their AI deployment strategies on high-demand topics. Our data reveals clear priorities. Common conditions, prescription medications, and fitness and nutrition consistently rank as the most searched health topics using AI. By aligning initial AI capabilities with these high-demand areas, digital platforms can maximize adoption rates and demonstrate immediate value to members. Next, users express increasing confidence in AI to complete basic tasks. A majority of respondents trust AI chatbots equally or more than medical professions to complete simple tasks such as looking up symptoms of a common illness. This growing confidence extends across multiple healthcare tasks, from describing medication side effects to explaining medical procedures. This signals member readiness for AI-powered self-service tools. And lastly, and likely our most important finding, generative AI is helping users make informed healthcare decisions. The vast majority of our healthcare respondents reported that Gen AI is helping them make informed decisions about their health. This isn't just about convenience, it's also empowerment. Members who feel equipped with comprehensive, accessible health information are more likely to engage proactively with their care, potentially improving their health outcomes and reducing unnecessary utilization of health services. With that, I'd love to jump into the first section we'll be covering today: current usage and behaviors. Understanding the behaviors and practices of your member population will help you craft digital strategy that meets patients where they are. AI has quickly become integral to consumers' daily lives. An overwhelming proportion of our survey respondents, at approximately 89%, reported using AI at least once a month, while half use AI at least once a week. Generative AI is not a tool consumers leave and come back to a few months later. It's an instrument consumers are using across different fields at an increasingly high rate. Individuals are very satisfied with the content they're receiving from generative AI, with our survey reporting 76% of respondents agree or strongly agree that using their preferred AI tool is easier than searching for an answer on their own. Health platforms should leverage consumers' budding reliance on the ease of AI to increase engagement on their own platforms. Unsurprisingly, millennials and Gen Z are leading the charge when it comes to daily AI use. With the growing economic power this generation yields, their preferences and engagement patterns are going to shape the success of digital health platforms. It's also worth noting that while Gen X and Boomers lag younger generations, a definitive majority still engage with AI on a monthly basis. All in all, AI usage and satisfaction rates are high across the board. When we examine AI literacy, however, we see generational divides that should influence health plan implementation strategies. Here, we're going to look more at AI literacy. General and health literacy are two essential skills for navigating digital healthcare platforms. As AI tools begin to pop up across these platforms, AI literacy should also be viewed as extremely important. To ensure that patients can use AI safely and effectively, they should be educated on AI's limitations and shown how the phrasing of certain prompts can really impact subsequent responses. Understanding how different generations interact with generative AI and their literacy levels can inform targeted deployment of generative tools. There is currently a 40 percentage point gap between millennials/Gen Z and boomers plus when it comes to high AI literacy. Where 60% of millennials/Gen Z self-report a strong/extensive understanding of AI, 40% of boomers plus report a limited/minimal understanding. This signals that older populations may benefit from a more guided AI experience with explicit instruction. On the other hand, younger consumers may prefer a self-directed experience. Healthcare organizations, particularly those with large enrollee segments of older populations, should consider supplementing AI tools with clear guidelines, tooltips, and educational resources. Insurers that offer Medicare and individual and family plans should perhaps also consider offering a more supportive experience on their digital Medicare portals. As digital healthcare strategists, you understand that meeting consumers where they are is key to driving engagement. This graphic highlights exactly where today's healthcare consumers are turning: ChatGPT, Google Gemini, and Microsoft Copilot. The majority of our respondents indicate that they've interacted with ChatGPT, with 47% indicating that this is the chatbot they've used the most. But how will knowing the most popular AI chatbots help you draw in consumers? When we look at the concentration within these three tools, we see clear brand preferences emerging. For health insurers developing their own tools, understanding these preferences is critical for creating familiar yet functionally distinct AI-powered care tools. The design of these chatbots should be a foundational inspiration to draw upon. Towards the end of the webinar, we'll actually take a look at a recent AI-powered solution rolled out from a major healthcare player that models this precedent. Across age groups, literacy levels, and usage behaviors, consumers consistently choose mobile devices over desktop for AI interactions. Among individuals who've used generative AI on both platforms, 61% prefer mobile. But here's where it gets interesting. When we break this down by generation, we see a clear upward trajectory. 50% of boomers plus prefer mobile devices. That jumps to 63% for Gen X and further climbs to 65% for millennials/Gen Z. This reinforces everything we've discussed about generational AI adoption. Younger users aren't just more literate with AI, they're increasingly mobile dependent for accessing it. What does this mean for your digital strategy? As you craft AI-powered solutions, mobile integration should be a priority. When we look at the importance of mobile integration, specifically within the context of healthcare, we see why. AI exponentially amplifies the convenience of mobile by placing advanced reasoning right at your patient's fingertips. This can help your beneficiaries access comprehensive health management resources with just a few taps. It's this type of technology access that is clinically proven to empower user action and enhance patient outcomes, and that ultimately reduces strain on both healthcare organizations and patients' health. And finally, as we get ready to discuss what healthcare consumers want in their AI solutions, I want to introduce you to some data specifically focused on the search habits of healthcare respondents. When healthcare respondents, people who are actively using AI for health questions, need medical information, here's where they're turning. Search engines still lead at 66%, but AI-powered chatbots have claimed the number 2 spot at 46%, narrowly edging out healthcare providers at 45%. Now let's look at the gap. Health insurer member sites sit at just 21% as a source of information, a 25 percentage point deficit compared to AI chatbots. Hospital and health system patient portals are only slightly better at 26%. This data makes it clear that the healthcare education landscape is shifting. For decades, search engines owned health information discovery. Dr. Google became a shorthand for self-diagnosis. And in AI's race to compete with search engines, it swiftly outpaced the digital properties that health organizations have spent years building. As one respondent told us, AI has become an additional tool to help with their healthcare journey. So when implementing new member site and patient portal capabilities to capture engagement, design AI that advances users' care journeys with intentionally crafted education. Ensure these tools draw from reputable sources and can direct members to care entry points, such as primary care provider locator tools or virtual care pages. With that, the path from prompt to patient care becomes seamless. This approach may help you draw healthcare consumers back into your platforms. And now that we've established an understanding of consumer behavior surrounding AI, let's take a closer look at what healthcare consumers actually want from their generative technology tools. And remember, at any point during the presentation, please feel free to add a question to the Q&A. Healthcare respondents aren't limiting themselves to simple queries. They're exploring everything from chronic disease management to dermatology to mental health support. The range here is significant because it shows a genuine demand for comprehensive health education. Common conditions lead at 53%. This includes seasonal flu, strep throat, and COVID-19. Prescription and over-the-counter medications fall at 50%. That shows a clear demand for accessible medication guidance. Fitness and nutrition sit at 43%, while mental health and well-being, chronic diseases, and skincare all cluster between 38 to 39%. This distribution gives us a practical roadmap. Starting with high-demand topics like common conditions and medication information makes sense because these areas build trust while addressing commonly broached questions. From there, expansion into wellness categories where engagement is already strong becomes a natural next step. What makes these topics particularly well-suited for AI is that they largely represent self-management opportunities. These are areas where clear, accessible information can help members make better decisions about their health. That creates values on both sides, for members that get the guidance they need when they need it, and for your care teams and nurse lines that can focus their expertise where it's most critical. Here, we find that users' interests align across separate groups. The interests of non-healthcare respondents align with the practices of healthcare respondents, as you can see from the above distribution. Common conditions again leads as the most popular topic non-healthcare respondents are open to researching with AI, and that's at 43%. Fitness and nutrition follows at 38%, narrowly exceeding skincare, hair care, and dermatology at 36%. It's not just the respondents with high AI literacy or the millennials/Gen Z that are interested in these topics. The majority of consumers clearly show a desire for AI support within these areas. The convergence of these interests reinforces the roadmap we previously discussed. Health platforms should prioritize self-management areas to cultivate the highest levels of early engagement and build from there. Based on everything we've seen in the data, here's a practical deployment path organized around 3 priority areas. First, we have common conditions. This is your entry point. With high demand and relatively low clinical risk, this area offers immediate value to members dealing with everyday health concerns. Think symptom checkers, care navigation for common illnesses, and educational content about seasonal health issues. This will build trust and demonstrate value rather quickly. Second, we have prescriptions and over-the-counter medications. There's already an intense demand here, with 50% of healthcare respondents already researching this topic using AI. Members want clear, accessible information on their medication. That includes information on side effects, interactions, proper usage, and cost comparisons. This is also where health plans can integrate pharmacy benefits and formulary information to create additional value for their members. Finally, we have fitness and nutrition. At 43% interest rate, this represents a massive opportunity for wellness engagement. This topic also represents an ongoing need that can cultivate sustained interaction with your platform. Tools like nutrition and vitals trackers demonstrate how AI can transform the complex task of health management into a more intuitive, personalized experience. So here's the strategy. Start with high demand, low risk topics that build confidence and engagement. Then expand into more complex areas as trust and familiarity grow. This isn't about deploying everything at once. It's about building a foundation that scales. Last in this section, we're going to shift from what patients explicitly want to what they implicitly need. One of the most encouraging findings from our research is that the vast majority of healthcare respondents are verifying the information they receive from AI. 82% cross-check AI-generated health information with other sources at some frequency. That's good news. We know that AI isn't always right, and that assumption can have incredibly negative consequences, especially in the field of healthcare. However, the verification patterns vary significantly. 20% cross-check every response they receive. These are our most cautious users. 27% cross-check approximately every other response, while 35% cross-check somewhat regularly. That leaves 17% of respondents who never cross-check their AI responses on healthcare topics. This represents a significant portion, possibly of your user base, that is engaging with potentially inaccurate medical information that could poorly affect their health outcomes. One respondent captured this sentiment perfectly. I trusted to a point, but always double-check the results. That is exactly the type of behavior we want to encourage. We want 100% of respondents cross-checking their AI-generated health information. For health insurers implementing AI tools, the lesson should be clear. Verification cannot be passive. It must be built into the user experience. Consider incorporating automatic links to reputable sources, easy access to official plan documents, and clear pathways to contact healthcare professionals for follow-ups. Make verification not just easy, but automatic. Next, we'll discuss how much healthcare consumers trust the information being generated by AI and any lingering hesitancies they have. Patients' trust in AI ranges based on the healthcare task at hand. To really understand how much confidence our respondents place in AI, we ask them to rate that level of trust relative to a medical professional. For every single healthcare task we tested, more than half of respondents indicated that they trust AI equally or more than a medical professional. The highest trust levels are for tasks that feel informational rather than diagnostic. 65% trust AI equally or more for looking up symptoms of common illnesses. 62% trust AI for describing drug information, and 59% trust AI for explaining the logistics of medical procedures and tests. Even for the most clinically sensitive tasks, assessing symptoms to generate a diagnosis and outlining treatment plans, we still see 52% and 51% trust levels, respectively. What this tells us is that members are ready for AI assistance across a remarkably wide range of healthcare needs. That means health insurers can deploy AI tools that complete meaningful tasks, creating a new space for digital health capabilities that are ultimately geared towards improving their members' outcomes. Here, we see how AI literacy affects satisfaction and shapes consumers' experiences. Users with lower AI literacy are less satisfied across every dimension. This gap may stem from not understanding AI's limitations and experimental nature. High literacy users approach AI knowing it can hallucinate and make mistakes. This reinforces why prominent disclaimers and education about AI capabilities are critical. They set appropriate expectations. Respondents with extensive or strong AI understanding rate their experiences higher across every dimension. 84% feel satisfied with their AI responses. 82% say using AI was easier than searching for an answer on their own and would also recommend the tool to others. For those with limited or minimal understanding of AI, all of these metrics drop. 70% feel satisfied, 66% find it easier than searching for an answer on their own, and 67% would recommend it to another person. While these levels of satisfaction are still relatively high, the gaps between high literacy and low literacy users range from approximately 14 to 19 percentage points. These are dips that digital healthcare platforms can easily address. Once again, certain individuals may not understand that AI is making mistakes. When they encounter these errors or inconsistencies, it may feel like the tool has failed them. The solution is to educate lower literacy users. Education is action, and empowering patients with clear information about AI's capabilities and constraints is key to building their confidence and increasing engagement. Prominent disclaimers, verification prompts, and educational content about how AI works are essential features that set appropriate expectations. And when you meet your users' expectations, they view your platforms as dependable and trustworthy. Finally, let's specifically examine barriers to adoption for younger patients. While younger consumers present as champions of AI, Millennials/Gen Z that don't use AI for health information, those of our non-healthcare respondent group, are more likely than Boomers Plus to report avoiding AI due to the potential of biased responses. These younger users are more concerned about bias corrupting their health and medical information relative to older generations. 47% of Millennials/Gen Z agree that AI produces biased responses. That dips slightly to 42% for Gen X and drops to 24% for Boomers Plus. That's a 23 percentage point gap between the youngest and oldest users. Millennials/Gen Z are concerned about bias in their responses for the same reason they're the most AI literate generation. They understand how AI training data works. They're aware that AI models can perpetuate inequalities, and they worry how this will affect the medical information they receive. Millennials/Gen Z represent the future of your member base, so proactively addressing bias and implementation strategies can help healthcare organizations position themselves as forward-thinking and user-centric. That means transparency about AI model training, explicit information about bias mitigation, and creating clear channels for reporting concerns. Preemptively addressing these concerns demonstrates a commitment to patient well-being and creates an opportunity to cultivate lasting engagement, especially because younger generations are still deciding which healthcare sources to trust. Finally, we're going to examine the AI-powered industry innovations that are popping up all across the health plan landscape. Here is what AI implementation looks like in practice. Highmark BCBS's member site offers an AI-powered symptom checker that represents a solid first step towards broader AI integration. The tool leverages an interface from Fabric, a health technology vendor. It provides personalized guidance that helps users assess their symptoms and locate appropriate forms of care. Upon entering their primary symptom, the tool generates a series of yes/no and multiple choice questions that evaluate illness severity, secondary symptoms, and bodily location. The tool handles expectations well. It informs users of the estimated assessment duration upfront, which is important given the dynamic nature of the interaction. What makes this tool so effective is that it empowers member action by creating a direct route from symptoms to care, with educational insights populating along the path. Diagnoses and medical terms are accompanied by straightforward descriptions and relevant images. Navigation to care options such as telehealth pages and provider locators tools follow the user's results, ensuring Highmark members know where and how to seek treatment. Now, there are still improvement areas. The tool design could be more modern and intuitive. The lack of flexibility around user inputs is a bit constraining. Users are limited to predefined options rather than natural conversation. As a first step, though, this demonstrates how AI can simultaneously address the knowledge gap we discussed earlier while empowering patient action. It's practical, it's useful, and it's user-friendly. While Highmark shows us a focused symptom checker, Anthem BCBS recently unveiled something more ambitious: a comprehensive virtual assistant with a design that closely mirrors ChatGPT. This interface will immediately look familiar to anyone who's used ChatGPT. Dark mode, conversational interface, and the suggested prompts all present clear parallels. This was a strategic decision. By mimicking an interface members already know, Anthem reduces the learning curve and leverages existing user comfort with AI tools. The virtual assistant handles diverse member inquiries, from benefits and coverage details to care coordination. It uses user-friendly language and provides relevant site navigation, making it genuinely useful for a wide range of member needs. We did encounter some inaccuracies during testing. The tool is currently marketed as being able to answer all questions, but can't answer questions outside of the realm of insurance coverage and member site capabilities. Still, this is what the future looks like: comprehensive AI assistants that handle routine inquiries, freeing up human resources for more complex cases. And with 24/7 availability and immediate responses, the tool is surely increasing member site engagement and satisfaction as we speak. Beyond Anthem and Highmark, several other major insurers have recently unveiled their own AI tools. Here, we have another handful of AI innovations and soon-to-be innovations across the health plan industry. Aetna and Oscar have recently unveiled their own AI tools. Aetna offers its members an AI-powered document search feature that pulls specific details from extensive plan documents. Navigating complex policy language is one of the most frustrating points of the member experience. But here, Aetna presents practical application that solves a real member pain point. Oscar has deployed an AI-powered chat that handles basic member capabilities, including ID card requests and claim information. For more complex inquiries, the chat connects individuals with care team members. While this represents a meaningful step forward in terms of driving the user experience, it's still very much a starting point. The chat feels more like a standard virtual assistant relative to the robust AI chatbots we've discussed today. Cigna is expected to release a new AI-powered virtual assistant in the coming months. As these firms continue to roll out changes to their member support capabilities, Corporate Insight will continue tracking innovations and report on what works. With that, I want to recap the insights you must keep in mind as you build out your AI-powered health solutions. Don't narrow your focus to desktop solutions. With 61% of users preferring mobile for AI interactions, and that preference climbing to 65% for millennials and Gen Z, ensure your AI tools are accessible from any device. Prioritize the right use cases. Approximately half of our healthcare respondents are already using AI to search for information on common conditions, prescriptions, and fitness and nutrition. These high-demand topics represent your clearest path to immediate member value and engagement. Start here, build trust, and then expand. Build trust through transparency and education. Embed verification prompts and disclaimers that encourage cross-checking and guide users to dependable sources. Make verification easy and automatic. Invest in AI literacy alongside AI tools. High literacy users consistently report higher satisfaction and trust levels. Educating members on how to use AI for healthcare effectively and understanding its limitations can directly improve their experience, your engagement metrics, and their outcomes. And finally, learn from early implementations. Major players like Anthem, Highmark, and Aetna have already deployed AI solutions. These early movers have started the race, but there's still significant opportunity for firms to differentiate themselves through user-centric design and offering that genuinely align with members' needs. Their action can be your inspiration. That brings us to the end of the formal presentation. So now I'd love to hear from you. If you have any questions at all about our findings or about Corporate Insights healthcare offerings, ask away. We have a question that says, do you know if any insurers are actually using ChatGPT or other mainstream AI platforms as the basis for their firm's AI experience? So we're currently tracking the 25 plus health insurers across our coverage set, and we've seen some implementation as shown by the examples of firms designing their own AI tools. And so we don't see any of them directly incorporating ChatGPT into their experience, but rather building off of their own platforms and interfaces. And we have another question that says, regarding confidence level in AI responses for patients, do hospitals and insurers have a slight advantage in building trust as industry experts? So I think this goes back to making sure that AI tools are pulling from reputable sources. We don't have any concrete data on exactly what sources that they're pulling from, but as we see in our report, they're mostly going to search engines. Some of them are going to WebMD. And so we don't see that hospitals and insurers necessarily have a monopoly as being industry experts because our consumers are mostly looking through their search engines. I see some financial services firms use AI as the initial step in their live chat experience. Is this a technique you see or can envision in the health plan space? That advantage being, if the AI assistant can answer a question, it's cheaper than having a human to do so. So we do see a lot of virtual assistants that lead to a live chat or a live agent interaction. And so that's actually discussed a lot in Corporate Insights live chat and virtual assistant report that is also from the Health Plan Monitor. So we see that a lot of firms do have that lead in from a virtual assistant to a live chat member and encourage members to first have their questions answered by the virtual assistant before directing them to like a real person to discuss that question. So we do have a question about the difference between healthcare and non-healthcare respondents, and just assessing the difference between these user groups. And so we do see that healthcare respondents and non-healthcare respondents have different behaviors just around frequency of usage and healthcare literacy. Our healthcare respondents are more literate than non-healthcare respondents, and they also use AI at a higher rate. It appears that non-healthcare respondents are more cautious around AI when it comes to sensitive materials, which includes healthcare and financial services. So we see that non-healthcare respondents and healthcare respondents do exhibit different behavior patterns from our survey data. And so I'm seeing one about just the use of AI solutions for prescription and pharmacy benefits and what that would actually look like in implementation. And so my mind first goes to using AI solutions when it comes to mobile apps. It's clinically proven that tools like personalized mobile app tools with personalized reminders and can improve medication adherence. So that's where my mind first goes when we're talking about how to implement AI in terms of pharmacy care. And I know we also discussed what it would look like on the desktop site. So I think that implementing LLMs that cover pharmacy coverage benefits, formulary information, as well as incorporating educational information on drug interactions and side effects is where health plans can really shine in implementing pharmacy-related AI solutions. Please feel free to contact the Corporate Insight team. This deck will be available on Monday, November 24th, and there will also be a blog post about this report coming out tomorrow on November 20th. But thank you all for attending.